In this video, we'll explain what blood sugar is, where it comes from, and what role it plays in the body. Blood sugar, also known as blood glucose, is the amount of glucose flowing through your bloodstream. Glucose is a simple type of sugar, and it's the body's main energy source, especially for your brain and nervous system. Now you might wonder where that glucose actually comes from. The body has three main ways to get it. First, from sugars in the food we eat. Simple sugars like those found in table sugar, fruit, and milk break down quickly and are absorbed into the blood. Second, carbohydrates. Foods like rice, bread, pasta, and potatoes contain more complex carbs. These take longer to digest, so glucose enters the bloodstream more gradually. And third, from internal reserves. When you're not eating, your liver steps in. It releases stored glucose from a substance called glycogen, or it makes new glucose out of protein and other raw materials. That process is called gluconeogenesis. Now that we know where blood sugar comes from, let's look at why it's so important to the body. Glucose is your body's fastest and most reliable source of fuel. Your brain depends almost entirely on it. When blood sugar drops, you might feel dizzy, confused, or even pass out. Muscles need glucose to help you move and stay physically active. And red blood cells can't use any other fuel. They rely on glucose completely, even when there's no oxygen around. Once glucose enters your cells, it's turned into a substance called ATP. This is the energy your body uses for almost everything. That includes contracting muscles, sending nerve signals, and even thinking clearly. When blood sugar levels are stable, you feel focused, energetic, and emotionally balanced. But when those levels swing too high or too low, that's when problems begin. Let's start with what happens when blood sugar gets too low. This is known as hypoglycemia. It usually means levels have dropped below 3.9 millimoles per liter. At that point, the body starts sending emergency signals. You might feel shaky, sweaty, or irritable. Your heart may race. You could get dizzy or confused. And in more serious cases, it can cause seizures, unconsciousness, or even coma. Low blood sugar often happens when someone skips meals, exercises too much, uses too much insulin, or drinks alcohol without food. Now let's look at the opposite problem. When blood sugar stays too high, this is called hyperglycemia. If your fasting blood sugar is above 7.0 millimoles per liter, it's considered high. The symptoms can build up slowly. You might notice frequent urination, unusual thirst, constant fatigue, blurry vision, or sudden weight loss. And if high blood sugar stays around too long, it can start damaging your body from the inside. It can harm blood vessels and nerves, raising the risk of heart disease, stroke, kidney failure, vision loss, and foot problems like ulcers or infections. In extreme cases, it can even lead to life-threatening emergencies like diabetic ketoacidosis or hyperosmolar hyperglycemic state. So whether it's too low or too high, unbalanced blood sugar can seriously affect your health. Keeping your blood sugar in a healthy range supports your entire body. When glucose levels are steady, your brain and muscles work better, your energy lasts longer, and your mood stays more stable. Hormones like insulin and cortisol can also do their jobs more effectively, helping your body maintain normal metabolism. And most importantly, keeping your blood sugar stable helps prevent both short-term crashes and long-term complications. This isn't just important for people with diabetes. It matters to everyone who wants to stay sharp, active, and feel good throughout the day. Thanks for watching, and see you in the next one.